Okay, my name is Lacey, and the topic that I chose for my presentation is disparities in healthcare outcomes among women. So, in this presentation, I'm going to be discussing the introduction and purpose of it, some contributing factors, intersecting identities, examples, and solutions, and a summary. Starting off with the introduction and the purpose, again, my topic is disparities in healthcare outcomes, which is defined as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Some examples of this are higher maternal mortality rates and delays in diagnosis and treatment for chronic conditions that affect women, such as endometriosis. So, my purpose for this presentation is to bring awareness to these disparities and the factors that contribute to them, and maybe even make healthcare professionals, which is my intended audience, aware of some of the personal biases that they may have towards others. This is important because these issues affect half of the population. Chances are you or someone you know has experienced these disparities within the healthcare system, whether you're a man or a woman. So, it's pretty important. Some contributing factors are, like was stated on the first slide, if you were able to read it, it says biological and physiological differences, socioeconomic and cultural barriers, and systemic issues. I'm going to kind of be touching on these throughout the entire presentation, so I'm not going to go too in-depth in them now. One of the other contributing factors is gender bias. I'm going to be focusing on this one quite a bit as well because my presentation is aimed towards women. So the graph on the right shows a little study or a little survey, I'm not sure of how many women, but it shows negative experiences with providers between women and men. So it asks them things like, were you ignored a direct question or request that you asked? Were you suggested that you were to blame for your health problem? And as you can see in every category, the women experience more negative outcomes than men. It also shows why women spend more at the doctor, and this can be for early age recommendations for checkups or things like high frequency of gynecological exams. From the article that this image is from, it states on average women spend almost 20% more out of pocket costs than men, even when excluding maternity costs, which means that they're paying about 20% more even before anything like pregnancy scans or just giving birth is considered. After that number is included, the number is much higher. A link that I put in here is to a TED Talk. I'm not going to show it for time purposes, but in the TED Talk, the speaker, Dr. Colleen Arnold, explained gender bias within the healthcare system. She discusses how it takes longer for women to get diagnosed with the same chronic conditions that men face, and how women often can get prescribed lower dosages of medications, whereas men can get prescribed regular pain pills for their issues. I suggest going to watch it. It was very informative, if you care about this issue. Moving on to some intersecting identities. So, race and ethnicity, being a woman of color, is an intersecting identity that can contribute to, or can kind of be the cause of disparities in healthcare. So, this can be because of chronic disease prevalence, some healthcare bias and discrimination, and just disproportionate burden of outcomes among women of color. Some more identities are women of the LGBTQ+ community and socioeconomic status. Both of these can kind of, again, because everything is kind of affecting each other, both of these can be combined with just being women. But if you're looking at them on their own, there are some things that interfere with them, like barriers to inclusive care, lack of knowledge on LGBTQ+ issues, and some health literacy. So some examples of this. Access is a big example. We've already talked about this a little bit before. Some factors that can impact this are things like money, location, discrimination, things like that. Even policy, which I'm sure you've probably heard a lot about if you keep up with the news. The graph that I chose to represent this discusses absence of healthcare coverage, some inability to see doctor, and cost-related issues between white women, black men, and black women. So as you can see, it kind of is varied depending on what the question is asking, but it's usually pretty different actually for each group. Maternal health. So, maternal mortality rate among black women in the US is, according to the TED Talk speaker that I chose from the video I watched, women are 246% more likely to die from pregnancy related complications. And as you can see on the right within the graph, it kind of shows how different the maternal mortality rate is from black women and white women, Hispanic women, and Asian women. Now, these are just from 2021 and 2022. I'm not sure how much it's changed over the past year and a half, 2 years. But as you can see, it's pretty different between, or it's a lot higher for black women. The TED Talk again that I linked, I'm not going to show it again, but if it's linked in the presentation, hold on. The speaker gives the example of Serena Williams, the famous tennis player. She states that after the delivery of Serena's daughter, she told her nurse that she was having chest pains, and her nurse dismissed her. Thankfully, Serena persisted, and they found out that she was developing a blood clot in her lung that could have killed her. So, despite having things like access and money and status, she was still treated pretty poorly in the healthcare system. The speaker also discusses her experiences losing not one but two of her friends who were African American women in childbirth due to complications that could have been prevented. So this is a part of the reason why the maternal mortality rate among black women is so high. Another example will be cardiovascular disease. The things that can contribute to this are undiagnosis and misdiagnosis between genders, men and women, differences in treatment and outcomes, and then some racial and ethnic inequalities. The graph here that I use is kind of older. It's from at the very latest 2007, but even then you can still kind of see the differences between men and women and how there were more deaths for women in with cardiovascular disease than men. Even though all this sounds pretty daunting, there are some solutions that could be made. So these can come in many ways, through policy level changes, provider level, and community level changes. So for policy level, they could expand something like Medicaid and insurance coverage for women-specific issues. For provider level changes, they can get bias training and inclusive practices if there's not already that in place. And for community level changes, there can be things like advocacy groups and educational outreach. And there's some more listed that I'm not going to read. So, concluding all of this. Disparities in healthcare outcomes are unfortunately a pretty common experience for many women. While there might not be ways to completely eradicate these disparities, there are measures that can be taken at the local and state level that I mentioned to overall improve outcomes in not just women but everyone. Advocating for friends or family members and being a part of groups that work to produce change within the healthcare community are small but impactful ways to help with this problem. Here's the bibliography. That's it. Thank you.